Hello and welcome to Pelvic Floor at its Core, the only podcast out there that is brought to you by a women's health medical technology company. I am your host, Shravya Kovela, pelvic floor physical therapist and business development manager at Flyte by Pelvital. We have a unique approach at Pelvital. We believe our product Flyte can provide life-changing outcomes, but we also know that no single treatment is right for everyone. We are therefore working hard to increase the collective knowledge out there about the importance of the pelvic floor. Because the more we work together, the more we can work towards increasing access to pelvic floor care so all women can truly live their best lives. On this podcast, I bring on pelvic health experts to talk about a variety of topics that any and every woman and clinician can relate to and learn from. It's always informative, always interesting, and we always have fun. So let's get into it. Hey, and welcome to another episode of Pelvic Floor at its Core. We are talking about all things pregnancy and postpartum today, specifically how to really advocate for yourself, as well as really great actionable advice to prioritize your pelvic health, well, even before you actually have a baby. This is a topic that every single person, mom or not, should learn more about. In fact, did you know that studies show that 77% of postpartum women had low back pain that interfered with daily tasks, or that nearly 65% of women reported sexual dysfunction in the first year following childbirth? Or that in France, women are automatically prescribed paid for pelvic floor training after childbirth, whereas in the United States, 1 in 4 moms return to work just 2 weeks after childbirth. Our guest today, Kelsey Beach, is a doctor of physical therapy and pelvic health specialist located in Kansas City and owner of Encore Therapy and Performance. Her mission focuses on empowering women during their reproductive years, especially during pregnancy and postpartum. You'll get to hear Kelsey's journey during her first pregnancy and childbirth, and it is certainly a journey, and how it motivated her to start her practice. This has been one of my favorite episodes to record, and you'll definitely hear why as you listen to it. So buckle up, and here we go.
Hello.
How are you?
I'm doing well. How are you today?
Doing well. Very excited to have you on Pelvic Floor at its Core. Super excited to talk everything pregnancy, postpartum with you.
Awesome.
I want to jump right into it. I know that you had a personal experience that kind of brought you to your mission with your practice.
Mhm.
And I saw your mission on your website and just felt like it was so great. It's very specific. You had written to empower women to rediscover their bodies, starting from the pelvic floor and core, specifically talking about how you will teach them about the changes their bodies will go through during their reproductive years and how they can manage their own symptoms and
Mhm.
advocate for their healing. So a ton of
Mhm.
women empowerment in there. I love it.
Mhm.
Share a little bit with us, just your own experience and what brought you to that specific mission.
So, the week I quit my job was the week I actually found out I was pregnant. And the initial goal of Encore was to help women rediscover their bodies starting from their pelvic floor. I've been a pelvic PT for almost 10 years, and every patient that I'd have come through clinic, even in these last 10 years, had always no idea what their pelvic floor was. Primary of my training had been in actually chronic pelvic pain. So you have these women coming in, chronic pelvic pain, you have no idea what their pelvic floor is. So I thought, with buying business, I want to keep going off that to keep empowering women to rediscover their bodies, but kind of take it in a smaller niche. But then the week I find out I'm pregnant and the week I quit my job, only to launch my
Big
business
week for
later,
you.
very big week, I start seeing a midwife. I absolutely adore my midwife, but I realized at that point, oh my gosh, this demographic of patients, pregnancy, knows absolutely nothing about their pelvic floor or the changes their bodies go through during pregnancy and postpartum. So my business actually had a complete rebrand almost a month or two in to gear towards pregnancy and postpartum to get the education out about what happens to your body. Pregnancy is 100% physical. We go through a giant physical change by growing another human being within our bodies. And all of this growth and change happens at and around the pelvic floor in our reproductive area. My midwife never during my pregnancy asked me how my pelvic floor was feeling or asked me,
Mhm.
how's your body feeling? It was always come in, check my weight, and then check my blood pressure. They never said, how's your body feeling? And so my goal with Encore is to just teach women about what their pelvic floor is and what happens to that pelvic floor during pregnancy. And then on the postpartum side, teach you how to use this whole new body that you get after you have a baby.
Mhm.
We stigmatize the whole bounce back, you have to do this. And no one realizes how the heck to use this body that went through a huge 9-month change.
Right.
And
Absolutely.
we just kinda treat it like, "Oh, yeah, you just had a baby, like, just go on with your life." Like, what? I also forgot to mention, 2 weeks before I found out I was pregnant, I had actually had a hip labral repair with an FAI repair.
Oh my goodness.
And so with that, I had to do 12 weeks of rehab. And this was a pretty minor surgery.
Right.
And I pushed a baby out of my vagina, and no one said, yeah, you just had a pretty major, not traumatic experience, but a pretty major physical change of your body. No one mentioned rehab.
Right. And we're asking you about your pelvic floor muscles, like you mentioned.
Yes.
It's just
So
crazy.
then my goal is just, as I said, to teach women about their bodies and what the heck happens to it during our reproductive years.
And why do you think that there exists like such a lack of resources in our society for perinatal and pregnant women? Is that how society looks at pregnancy? Like this is normal, you just need to deal with it? Is it something in the medical community? I feel like there's going to be collaboration here. I feel like it's going to be
100%.
all of that together. But
Yes.
what do you think?
My thought is women have been having babies since the beginning of time. Birth providers, and I'm going to completely pigeonhole OBs because they dominate the birth provider world. I think
Hmm.
OBs just see it as, well, yeah, women have been doing this forever. Whatever happens is just normal and you kind of just deal with it. But I think we're seeing a shift in our moms and they're saying, oh, wait, this isn't normal. And the shift of pelvic PTs that are coming forward and saying, you're right, mom, that's not normal. And I can actually treat it.
Hmm.
We're seeing this bigger and bigger boom. And we're graced with this beautiful free platform of marketing called Instagram, Facebook, social media. And we
Right.
can put our experiences out there a lot more quicker
Hmm.
and show, yeah, this actually isn't as pretty as we thought. Oh, and she has this experience too. I think we're kind of banding together as women and saying, oh, this is common, not normal. And then
Right.
I'm seeing other providers pop up in this world that can actually treat it.
Right. Like, why does it have to be pretty? It's so glorified. Like, oh, you're
I don't.
pregnant. Let's take all these photos, which is so wonderful. We should celebrate that. That's great. But also, it's okay to have these other things going on.
Yes,
Like,
that
your
is.
body is totally
I
changing.
know. It's and there's one thing I've really geared towards my social media and my marketing as a PT is not glorify the postpartum stage, like the 4th trimester on. And we always say once you're postpartum forever. And my Instagram is by no means this beautiful, like Scandinavian sepia tone, like pretty rainbows. Like most of the time I'm in sweats. Most of the time I don't have makeup on. I've yet to figure out how to film a really pretty video, and I want moms to see, like, "Girlfriend, I'm in the trenches with you."
And that's
Like,
beautiful. Like, that's
yes,
beautiful too.
it is, and I love that, and I agree. I mean, we're finally gonna do family pictures with our son this month,
Hmm.
actually, and
It's
I went
exciting.
to the store today, and I was like, "I'm gonna pick out a really cute outfit." And this photo shoot is gonna be 15 minutes of our time, and that's it. Like, it is a snapshot highlight reel, and then we're probably all gonna go home, put our
Yep.
sweatpants on.
Such a good perspective. Yeah.
Mhm,
Like, enjoy
mhm.
it. It's great. It's wonderful. But there's more to it. More
Agreed.
to it than that.
Mhm.
Well, let me ask you this. So, if you were at your 6 weeks postpartum visit, you're seeing your OB,
Mhm.
what are you listening for? And how can you advocate for yourself in that visit based on what you're hearing?
Such a good question, and I think the past year has been such a complete, excuse my language, shit show of the 6-week follow-up because I have moms that come in and their 6-week follow-up was virtual.
Right.
No one even saw their vulva or vaginal area or cesarean scar.
Right.
And I think and my midwife, she even told me, I told her, I was like, "Hey, I'm having prolapse symptoms. I'm having XYZ. I am having some post-void dribble." I
Mhm.
checked in with a friend who's a pelvic PT. She did do an assessment on me. "What do you want to do, midwife?" And she's like, "Nothing. You're fine." And I
Mhm.
thought, "What?" And she didn't even check me. Like I didn't
Right.
even have assessment. And it was that moment where I thought, "Oh my gosh."
Yeah.
OB care quits when that baby comes out. And that's
Right.
fine. That's their job is to deliver babies. Their job is not to rehab pelvic floors, abdominal, cesarean scars. That's not their job. And so I think,
Mhm.
when I'm listening to when my moms come in, I asked, "How did your appointment go?" And they tell me, and I say, "Okay, perfect. Ask for a referral if it's a state that needs a referral for PT." But get out there and find the care that you need because your care stops with your OB when that baby comes out.
Mhm.
And that's fine. Like I
Right.
said, I don't ever want to deliver a baby.
Oh,
Like my
same.
job is not to deliver a baby. I want to rehab your pelvic floor and your core and your whole entire body. I don't want to deliver your baby. And
Right.
OBs, midwives, whomever your birth provider is, they don't want to rehab your pelvic floor. That's not their job.
Right.
And so just changing that narrative and educating the community and saying, that's where their job ends. Here's where our job starts. It's kind of what I'm hearing coming out of these 6-week appointments.
So I'm hearing from you that if you go into your 6-week appointment, your OB's not asking you about your pelvic floor, it's okay to ask. It's totally
Yeah.
okay to say, "Hey, what about my pelvic floor? Can I have a referral?" And
Yes.
a lot of states, I think all states have direct access now.
Mhm.
Well, so direct access, for those who aren't listening and are not aware, means that you can go see a pelvic floor physical therapist or just a regular physical therapist without a referral from your doctor. Each
Mhm.
state has some different rules about how long you can see that provider for, but it is available. So you might just make an appointment and then learn that information from your PT, and they
Yes.
can guide you.
Agreed.
Well, let me ask you this because I'm a pelvic floor physical therapist, and
Mhm.
I don't know about you, but it is so hard for me to not get involved with friends and family who are pregnant or postpartum and say, "Hey, are you advocating for yourself?" But it's tough, right? Because I feel like I have so many friends and family who are just such smart, wonderful, incredible, capable women and are just so caught up in their busy lives. It's a totally stressful time. They have a
Mhm.
newborn, they're working, completely valid, crazy lives, but they will not prioritize their pelvic health. And I want to ask you and see your opinion on that. How do we continue to support these women? And how do we continue to raise awareness and create resources for these women who may know that something isn't normal, but are just
Mhm.
so busy and just have a tough time advocating for themselves? How do we support them to eventually, like you said, postpartum is life, to get to a place where they can seek care?
Such a good question, and I wish I had the best answer, and I don't because being that new mom, it was so hard to think of myself,
Mhm.
and I think what I tell my moms, and I even did a social media post about this the other day, is that, you can ask at your birth registry, at your what do we call these? Baby showers, ask
Mhm.
for funds to go towards postpartum doulas, pelvic floor PT, go get a massage.
I
You can
love
ask for
that.
that or even ask your partner, say, "Can I take 1 hour a week to go take care of myself?" It might have this, a fund labeled to it that is not in our budget, so can we ask friends and family for that instead of buying a $300 car seat? Those are still hard conversations to have because pelvic PTs, we're still new. We've been around for a bit, but we're still kind of new. Finding that time, finding that 1 hour a week, and I tell my new moms, it's my goal is not to see them forever, but I need to see them enough to teach them about their bodies and then build them this beautiful toolkit for everything that they can do at home.
Right.
And once you tell them that this is I don't wanna see you for 12 straight weeks. When I was in group clinic, every patient that came through my door, I had to see them for the initial eval and then schedule them almost 3 months out. because
Mhm.
we knew insurance, we could get the most out of them that way.
Yep.
But once I went solo and cash, I said, "Hey, mama, I see you. I'm in that trench with you. I'm going to walk alongside you on this journey. And let's maybe start once a week for a couple weeks. And then let's taper up because I know you have your mom life to tend to. And that's hard."
Yeah.
I had a discussion with my husband about that. And mine was postpartum mental health awareness. I was struggling with postpartum anxiety. And I asked my husband, I said, I need once, and I think my group met every other week. I said, every other week, I need time to myself to go to this postpartum anxiety group because I need to be a good human being. And my husband was like, obviously, I think this is a good idea.
That is so great to hear that
It is
you
great.
did that because that is
Yes. And
so hard. It is so hard, and we shouldn't underestimate that.
we shouldn't. And I
Mhm.
think the same thing goes with pelvic floor physical therapy is that these changes are not changes that we have to live with, but
Right.
we also then have to get over the initial hump of our OBs telling us, "Oh yeah, the first year is just kind of everything's normal, so just deal with it."
Mhm. And then once the first year is gone, it's the second year, and life has moved on, and you had your baby a
Exactly.
year ago, so why do anything? No,
Exactly.
totally.
Or you have another one, or you something,
Right.
and I've really learned as a new mom and a business owner, it will always be something. Something will always
Mhm.
happen. Like, for instance, I was late to our call today because my car was dying. Like,
Right.
there will always be something that gets in the way. And so just reconfiguring how to even take 1 hour a week
Mhm.
to care for yourself.
I love how practical that advice is, and you gave some really great suggestions in there. Hey everyone, just popping in mid episode to say that this podcast is brought to you by Flyte by Pelvital. Check out our website at www.flytetherapy.com. All right, back to the show. I want to bring things back a little bit to kind of the biomechanical angle
Yes.
and ask you about what very specific things do you wish your patients or just women in general knew before or during pregnancy to really prepare them for an improved quality of life?
Oh my gosh, don't just only do Kegels. That
Yeah.
is like the answer to everyone's pelvic prayers is just do Kegels. And I wish we quit taking that label away of the Kegels are the answer and really
Mhm.
educate women on the biomechanical aspect of your body is going to change in 3 different planes of motion. And this is like the PT nerds in us right now. Like, we have 3 planes of motion in the body, and biomechanically, your body will change through all 3 of those planes. And then to birth a baby, that baby comes through those 3 planes of motions to even descend out.
Mhm.
So, doing Kegels, which is a one plane contraction, is not the answer to A, birthing your child, and learning how to use our body to traverse those 3 planes of motion to get our baby out is key. And
Mhm.
I say that out loud, and moms are going to hear that and be like, I don't even know what that means. Like, what does that even mean? But that's where pelvic PTs come in, and we can teach you how to use our bodies to move correctly biomechanically through these 3 planes of motion during pregnancy for less pain, more stability, and then during labor and delivery to help push a baby out. I'm a firm believer and we're not meant to push babies out on our backs with our legs up in the air.
Mhm.
Um, which is funny because that's actually how that's the only way my child was coming out.
Oh gosh.
But he was stuck. He did not want to budge. And so that's what we had to do. But I labored in multi-plane positions because that's how we have to use our bodies. And that's where coming back to what I
Right.
was saying is pregnancy, labor, and delivery is 100% physical. So leave it to the PTs to help us teach you how to get ready for that.
Right. And
That was a
I
really long answer to your question.
no, it was a great answer. I think what you said is so insightful about there being these three planes because I always say like Kegels can be part of the answer, but it's
Agreed.
not the only answer.
No.
And
No.
it's just really important to have that education and awareness. I think there's a lot of women out there who are pregnant and don't know that you can labor in other positions. Like in what movie have we seen someone labor in
Um,
another position, right? It's like,
I know. Yeah, it's probably some indie film that, like, never even made it to big
oh
screen
yeah.
because it shows a reality of life that just people don't like seeing. We're
Right.
taught, we're ingrained in our minds on your back, legs up in stirrups with like 6 people yelling at you to push.
Mhm. Yeah, absolutely. Curious, in your experience, because you
Mhm.
had that hip surgery or that hip pain,
Oh,
how
yes.
was that for you? Because I know just with your legs up in the air, that hip in that position for a prolonged period of time, curious
Mhm.
how you
So
did with
the
that.
the rule was when we got to the hospital, because I had a midwife birth at a hospital, we told everyone, "No one can touch my right hip but my husband." That because it was I had right hip surgery, and I said, "That hip is off limits for anyone to touch. It cannot move past a certain range." Because I said, "I'm not gonna put my body through anything to re-tear a labrum." I had a 33-hour labor, and then I pushed for 3 more. In my
Okay.
pushing phase, I did get an epidural. I was on my sides, my right side, my left side lying, and then I was even on all fours. Another really good thing with labor and delivery is to get your hip into internal rotation. And so before we got my epidural, I told my husband, I was like, check to see how far this hip can go,
Mm.
like that I'm comfortable with. And I teach this too in my birth prep class is if you do opt to get an epidural, more power to you, but check to see what your mobility is before you get that epidural. Cause once you get it,
Mm.
someone can pull or move your leg into that position and you're not going to have any good sensation for it. So,
Right.
kind of with me, yeah, the rule was no one could touch my hip but my husband. And we had to check it to kind of see how far the range would go before my epidural was full force.
And did he do that with you right there in the hospital, or was that something you guys
Yeah.
had checked before?
We
Yeah,
we had
right
talked
there.
about it. We talked about it before.
Mhm.
And then in the hospital too, when I was so like I said, I was pushing for about at around 2.5 hours. My midwife came in and she's like, I know you don't want to birth a baby on your back, but he is not budging. This is our first intervention. I need you to get on your back. Push. And it was closed glottis push, which I also don't loving. She's like, let's just at least try this and see what happens. And she's
Mhm.
like, well, we're going to honor the hip. We're not going to. So I didn't do stirrups. I had my husband hold my right leg the whole time.
Nice.
Um, and then so that was nice because that gave me a more autonomy, so that's kind of the one reason I was comfortable getting in that position and quote
Right.
unquote pushing the old way is to my midwives, they were like, "You do what you need to do, but this is our first line of intervention
Mhm.
to get him to move."
And it
And but
worked.
yeah, it was scary and luckily my hip came out okay and
Good.
still rehabbing it every day
Yeah.
and moving forward with it.
There you go. Well, I think it's really inspiring to others who are listening that you came in with a plan. And
Yes.
yes, it changed and you made it work and things were okay, but you
Yeah.
were still advocating for
Exactly.
yourself and you have your partner and you were using your partner,
Mhm.
like that's okay to do. How great is
Exactly.
that?
It was amazing, and I tell all my women in my birth prep, I say, "Be open to the edits. Have a plan, but be open to the edits because, I'm teaching you the physical therapy aspect of this. I don't deliver babies. Your birth providers do.
Right.
This is what they're good at. So take their cues, listen to them, and be open to what edits they have because ultimately they know how to get babies out. I don't."
Mhm. I love that. Well, Kelsey, let's go right into our case study since we got
Okay.
into this great conversation about your experience.
Mhm.
So let's start with just some of the key things that we should know about the women in your case study, like a subjective history or things that stood out to you.
Yeah. So the one that I'm going to pinpoint is it's a gal that I've been seeing. She is 3 months postpartum. She is an amazing, active, she loves exercise. She loves group classes. She loves strength training. She had her first baby. She advocated for herself. She's like, I need to get some pelvic PT, came to me with her symptoms. And I told her, I said, it sounds like you have prolapse. And she said, "What's that?" That's the most common thing is so many of my women have no idea what prolapse is. So I
Right.
did a prolapse screen on her. She indeed had kind of grade 2 bladder prolapse, rectal prolapse. Now, completely common for vaginal deliveries. I actually have that stage as well. And I told her, I said, "Okay, here's what you have. Here's your option. We can do pelvic PT." And all these women at this phase, I always send them to the local urogynecologist that I love. And I say, get fitted for a pessary. I love pessaries. I'm obsessed with pessaries. So she went, she advocated for herself. She went and got fitted for a pessary, came back, saw me, said it fits great, had an OB appointment. She told her OB, I'm seeing Kelsey Pelvic PT. I saw the provider that she likes for Urogyne. I got fitted for a pessary.
And
Um,
Kelsey, real quick, just tell us what a pessary is.
a pessary is a small medical silicone device that you insert into the vagina to help give your organs the support they need while we're going through our kind of at any stage of life, but I love them postpartum. It helps give the organs they need while the body is still continuing to heal from the huge change hormonally, connective tissually, and musculoskeletally from labor and delivery. It's just a simple device that you insert in and it lifts everything back as where it needs to help, like I said, with the healing and help give the pelvic floor a little bit of extra relief to work on strengthening.
Right. Perfect.
Mhm. So my patient goes back to her OB, says this XYZ, and her OB says, "Oh yeah, everything that you're going through is normal. That's why I don't ever refer out for PT or pessaries."
Oh man. Even after she had seen you and the Urogyne.
Yep. And we've been working on some beautiful retraining, different positional training for the pelvic floor relief. And my patient just looked at me and she said, "I've made so many gains with you and these changes than I would have had just listening to my OB just say this is just normal."
That's powerful.
Yeah. And that was the case study that I was thinking about. And we've been working on, as I said, like beautiful positional relief to relieve the prolapse, to fire the pelvic floor a little bit better. Triplane motion, which I love. We've actually got her back to strength training.
That's
Um,
great.
Very modified positions. And she told me the other day, she's like, "I feel so much more normal, even picking up like a 5-pound weight and moving it."
Amazing.
Yeah. And it was
Amazing.
just so powerful. And she just thinks, "But my OB just thought, no, this is just normal. You just have to deal with this during the first year."
Right. Right. And these interventions that you did, well, let me back up to that. So,
Yeah.
what does positional relief and triplane motion look like in
Yeah.
specifics to this case study?
So, with what I do with a lot of my prolapse girls is when we're teaching them how to engage their pelvic core system, I always start with them on their backs just because gravity lessened positions that we typically know we like to test in. But then the positional reliefs is we actually do like a supported blocked bridge.